A charity that represents care providers in England says the government's coronavirus testing regime has had serious problems. It comes just days after the Department of Health and Social Care wrote to care home providers warning of a rise in new coronavirus infections within homes. The letter acknowledged it was mainly staff being affected, but also said some residents have tested positive too. Our social affairs correspondent Alison Holt has the full story.
In care homes like this one in Manchester, they've already had a long, exhausting fight against coronavirus. In April, they lost 9 residents. But with careful infection control like this and increased testing, they've managed to keep it out of the home over the summer. If there is a second wave, then quick testing will be vital in identifying people without symptoms and keeping residents safe. But Mark Adams, who heads a charity that runs 18 UK care homes, including this one, says in recent weeks they've had problems getting results in about 40% of their tests.
At the moment, we are getting the kits for weekly testing, but the results are coming back 5, 6, 7 days after the test was taken. So if someone does catch COVID, they could perhaps be in the building for 3 or 4 days without even being aware that they're ill.
As the infection rate rises out here in the wider community, inevitably care homes are going to feel the impact. On Friday, the Department for Health and Social Care sent a letter to care bosses warning that they were beginning to see a rise in cases in care homes. The majority were staff who'd become infected, but some residents had also contracted the virus. And it's reported in the Sunday Times today that infections in care homes have quadrupled since the start of the month. As demand for tests rises in the general population, care providers say it's vital the care sector is made a priority.
I think the testing regime has had serious problems, and I really want the government to prioritise care services. We saw at the start of this pandemic that people living in care homes were the most susceptible to the virus. So I hope that what they will do is they'll realise that and they'll start prioritising the testing in care homes.
The Department for Health and Social Care says since the start of the pandemic, it's done everything it can to ensure the safety of residents and staff. It says laboratories are turning tests around as quickly as possible, and it plans to expand the system in coming weeks.
Alison, there's clearly growing concern within government and Number 10 about the rising infection rates in wider society. We're seeing the introduction of the rule of 6 in England tomorrow, toughening the restrictions, and yet seemingly little mention of care homes in all of this.
Well, you can certainly understand the reasons for the growing concerns. Tonight we've got new data from Public Health England which shows more than 500 new cases of COVID-19 were recorded in Bolton in the 7 days up to September the 10th. That's the equivalent of 192 cases per 100,000, the highest rate in England, and a significant increase there from the just over 126 cases per 100,000 the week before. Now that's obviously worrying, and going back to what care providers were saying in my report, you can absolutely understand their nervousness, particularly when you remember the high number of deaths in care homes across the UK at the peak of the pandemic. Now, the government's expected to publish its winter plan for supporting social care in England in the next week or two. That should be shaped by a task force of experts who provided ministers with their plans, their ideas at the end of August. Any plan will need to come up with ways of ensuring good access to PPE, rapid testing, and also importantly money. I'm told that the current infection control plan, which is operated by councils, is running dry. Now, since May, that has been used to limit the movement of staff within care homes, for instance, by paying agency staff a retainer to only work in one place. And when you look at those rising infections in the community, you can see why that is viewed as being essential for protecting care home residents.
OK, Alison, thank you. Alison Holt there.